Today we're going back over start position or first position from dynamic neuromuscular stabilization. So the basic setup for this is going to vary a little bit for everybody. So if we have Seth sit all the way back into what's classically known as child's pose, you're going to see that his kind of upper lumbar spine flexes quite a bit. So the first thing we're going to do is kind of centrate his lumbar spine. So we're going to ask Seth to kind of start crawling his elbows forward in space until we see that he can kind of get this a little more into a neutral position. So this is actually his start position. Now from here, we want the elbows, depending on where we're going with this drill, but the basic position is a little bit outside of the shoulders and then a little bit in front of the shoulders. So that's going to be a little nicer position for his shoulder blades. And then for the basic position, just the hands kind of laying at rest flat on the table. So now we want to kind of get a good position in the neck going, which is usually a little bit of deep neck flexion. Before we think about elongating the spine, we're going to actually try to use the cue, which Seth is actually doing pretty good anyways, of east and west on the shoulders. So somebody that wants to go into our shoulder or into our hands here. A couple different ways to cue that. And you can see that Seth wants to flex his spine a little bit when we do that. We could give him that cue at the elbows, give a little bit of outward push. We could give it up top, yeah. And then from there, our second thing we want when we have this kind of support structure of the middle trap and rhomboids, all the things around here, is now can we get Seth to axially extend. So if we don't let him move from his sacrum, he's going to try to grow as long as he can through the crown of his head. In ideal world, wherever he's having a problem or where he's escaping, maybe it's TL junction, maybe it's mid-thoracic spine here, that's where we're going to get elongation. The last thing we would work, so east and west, right, or this lateral expansion, axial extension, now it's actual extension or flexion. So now we may say, Seth, can we drop down here? Yeah, and that's really good. And now we're working all three planes of motion in one quick drill, and that is our start position.